So our course structure, we have 2 years. The first year is where you learn your foundational theory, but we also have a lot of observational placements within that. So you have a strong context for the clinical environment to help you learn the fundamental skills. The key practical skills that you will need going on to placements are taught in year 1, so assessment and treatment, and the theory for pillars of clinical practice, including neurological, cardiorespiratory, and musculoskeletal. Then in year 2, you will go on to your intensive clinical placements, which will be 5 weeks long into a health service. And they will include a cardiorespiratory, a musculoskeletal, and a neurological placement, as well as specialised placements and the opportunity for overseas placements. We also cover advanced theory, including sports, exercise and physical activity, evidence-based practice, and career development and leadership subjects. Upon completion of our degree, many Canadian students will return to practice as registered physios back at home, either immediately or after a period of working in Australia. So you need to complete at least 1,025 supervised clinical placement hours to be registered with the Canadian Alliance of Physiotherapy Regulators credentialing process, which also needs to cover 100 hours of musculoskeletal, 100 hours of neurological, and 40 hours in cardiorespiratory clinical practice. The total of 1,025 supervised clinical placement hours does exceed the requirements of most Australian physiotherapy training programs. So to bridge this difference, we have an additional subject comprising of 150 hours of supervised clinical placement that will be made available to Canadian students at the standard cost for a unit of study. So this will increase your total clinical placement hours to 882. And this subject will appear on your official university transcript and will be counted in the total supervised clinical placement hours documented for the Canadian registration. Then you'll have 2 options, which are outlined on this slide, to achieve the last 143 hours of placement. So option 1 is you can achieve this through paid work as a physiotherapist in Australia after you complete the course. Or for option 2, we can provide another clinical placement for you, and we will source that through us, and we'll charge it at the standard rate of a unit of study. And we will make sure that this subject occurs immediately after you finish the course, which will happen in December to February of your last year.